Dr. Graham here at the Daily Dentist. Today I want to talk to you about the difference between silver fillings, what we call amalgam fillings, and tooth colored fillings, what we call composite resins or bonded type fillings. A lot of times people say they want to get their silver fillings removed because it's got a lot of mercury in their mouth, releasing mercury, and it's bad for their health and all these other problems. When silver fillings were first started, amalgam fillings, they back in the day, early times, probably maybe 60, 70 years or more ago, fillings were made in the dental office. So you had the material that were not together, so you had to mix them together and put them in a little what we call mortar and pestle, mix them all up, get them connected or mixed really well. Then the dentist had to pack them in the tooth. And so doing that, you have a little bit of mercury in it to help get the material together and make it more malleable or movable. And so as the dentist was mixing those things, you get mercury vapor that was released into the air. So in those days, the silver fillings or amalgam fillings was more toxic to the dentist than to the patient. Because once the material is mixed together, it's in an inert or non-active state. So it's mixed together, it's put in someone's tooth, it's not active anymore. And so it's not releasing any mercury because it's in a mixed state where it's stable. And so silver fillings are good fillings to be done. And they were one thing about silver fillings, when you clean out the tooth and you put a silver filling in, once you did it, you did not have to worry about, isolating the tooth, keeping a lot of moisture or saliva out of the way, because it would not contaminate the tooth. You get it into the filling, and once it's in there and it sets up, it becomes harder over time. The good thing about silver fillings, once they're in the mouth, they seem to become more stable over time. And sometimes people say, oh, my filling is black or decayed or is looking bad. And that's because it starts to what we call oxidize in the mouth. And so it may discover, depending on what type of silver filling was placed. You have different types of silver fillings, which I won't get into the different chemistries and different types, but you have a type of silver filling that when you placed it in the mouth, it did not oxidize, and some that did. And so as these fillings came out, more dentists start using the fillings that did not oxidize or turn black. And so they remained a silver color in your mouth. But silver fillings, they're not toxic or anything, not releasing mercury out of your body because they're stable. And so they're in what we call an inert state. They're not active. And those fillings are good fillings, they're solid fillings in the tooth. The difference with silver fillings as time progressed and we got more to the tooth colored fillings is when you did a silver filling, the dentist had to open the tooth a certain way or make a certain shape in the tooth so the filling would stay inside the tooth. You had to cut at certain angles and certain particular way to get the filling to stay into the tooth because it was not bonded like the tooth colored fillings are these days. So you had to take away a little more tooth structure when you did a silver filling. So when tooth colored fillings came about, or bonded or composite resin fillings came about, those fillings, you were able to be more conservative, to take away less tooth structure when you did that. But with that said, those fillings are more technique sensitive. You have to make sure the area is real isolated, dry, not a lot of saliva or water is getting into the mouth or on the tooth that you're preparing. So you have to make sure it's isolated and dry. And like I said, it's very technique sensitive. It has a lot of different steps and stages you have to do to prepare the tooth before you can get the tooth in there. And then you would have a special light that would activate or make the tooth colored filling or the composite resin hard, and it sets it up. Now, when you did these type fillings, if you did not do them correctly or you didn't have the mouth dry and have everything isolated properly, you can get some sensitivity in the tooth. And sometimes people say, oh, doc, I had this filling done, now my tooth is sensitive, and it was fine before. Because like I said, those fillings type procedures are really technique sensitive, so you have to make sure you're doing them, isolating the tooth, doing the proper steps, not cutting steps, to try and have the tooth sensitive free if you do it the proper way. Either filling is good. Like I said, the silver fillings, they may last longer because once you put them in, they set up, they're there. But as they become bigger or larger, it makes it easier for the tooth to break or fracture away from the silver filling. You may see the silver filling still in the tooth, but the tooth around it may break. So that's why when you're doing fillings, whether it's silver filling or a tooth cut filling, you don't want to go past a certain size when you're doing a filling, because when you get past a certain size, then you're going to have what we call a crown put on the tooth, and that's a topic for a different day. But I just wanted to clarify the difference between silver fillings and tooth color fillings. Silver fillings, they're good fillings for teeth. You keep them on a certain size. They're gonna, once you get them into the tooth gonna be protected, not causing any problems. Now, any tooth or filling can get what we call cavities start up, recurrent decay, or cavities can start on them if you're not keeping your mouth clean and not having good hygiene. You can get cavities around a silver filling or tooth color filling, either way. Silver fillings may tend to hold up longer than tooth colored fillings because, like I said, the material is stronger. It's not going to break down as easy. It's not so much dealing with technique sensitive. As long as you prepare the tooth or cut the tooth in the right property and get the filling in there, it's going to last. Tooth colored fillings, like I say, you're more conservative. You can just take away the cavity or the defect in the tooth and just fill that part of the tooth that was defective. And so you're not taking away a lot of tooth structure. So that's the plus about tooth colored fillings. It's only removing a small amount of tooth. You're getting in there, but it's real technique sensitive. You have to make sure you're following the steps. The dentist has to make sure he's following the steps and doing the teeth the correct way so it decreases sensitivity. And it's a lot of other procedures that go involved, which I won't get in today. But I just want to try and clarify some things. A lot of times people thought silver fillings were bad, and I want to get all my silver fillings out and get a tooth colored filling. And that's fine if you want to do that. A lot of times people may not like seeing the silver fillings in their mouth if they laugh real loud and have a mouthful of silver fillings. They may want to have them removed. And those can be done. You can do them with tooth color fillings or other procedures that can be done that can match more of the tooth structure. But with that said, tooth color fillings are more technique sensitive, so you have to make sure the dentist has to make sure they're doing those in the right procedure, keeping everything isolated and dry, and so you won't have any sensitivity. And still, sometimes you can do that and may still get sensitivity. So it's other things that you can do to prevent that. But I just want to let you know that either filling is fine. Nowadays, more dentists have gotten away from the silver fillings and more into tooth colored fillings because, like I said, it's more conservative. You're not taking away a lot of tooth structure, which you had to do with silver fillings. Even though if you had a small cavity in doing a silver filling, like I said, you had to prepare or cut the tooth out in a certain shape for the material to stay inside the tooth. Now that you have tooth colored fillings, they bond or adhere to the tooth, so you don't have to make it as big. But like I said, they're technique sensitive. And but both are good, especially on kids. They may get silver fillings because it's tough. Kids trying to keep everything dry in the mouth, and kids, you have a certain amount of time when you're working on kids. So a lot of times the dentist did silver fillings on kids when they're baby teeth because they'll end up losing those teeth, and it was tough to keep everything isolated when you're working on kids. As you get older and the patient's able to sit in the chair and able to work a little longer, have more working time on the patient, you can do tooth colored fillings because you can isolate it more and make sure you follow the techniques that are needed to prevent some of the sensitivity outcomes. But like I said in the previous video, if you get tooth colored fillings, the teeth aren't going to whiten. But I just wanted to cover those two aspects between silver fillings and tooth colored fillings. Both are fine. Silver filling is not going to cause or release mercury in your body because it's in an inert state. It's not in an active state. And like I said, years ago, that was a problem because the dentist had to mix the material in their office themselves, which put out mercury vapors into the atmosphere where the dentist was breathing them in, and that caused problems. But we don't have that anymore. We have a certain way to mix them, get them in the tooth, and they're in an inert state. They're stable. But thank you again, and I'll see you next time on The Daily Dentist. Have a great day.